Well, certainly, we can invite everyone to put your name, organization, maybe your email or other contact in the chat so that we have that there. And anyone who's new to this coalition, if you want to come off mute and introduce yourself, say hello. A lot of us have been joining for a while now. And we welcome everyone. Or if anyone has really quick updates they might want to share. Resources can go in the chat as well. Looks like a few more people are still coming in to the room. And just for an overview of agenda, and as Laura was mentioning, we are expecting Deb Sorley today, which may shift our time a little bit. We definitely appreciate her participation and look forward to the opportunity to ask some questions.
If I could interject just briefly, Deb is trying to get into the meeting and can't access. She can't get to the link. Could someone send that to her? She said she's having trouble with the link.
So I thought I sent her the invitation. I added her to the invitation. Let me just understand. Let me see if I can figure out what's going on.
Thank you. So you've got that, Laura. And once we kind of get up and running, we're going to talk a little bit about SNAP changes, talk about the resources that we have here. Heidi will talk about application assistance, and Laura will talk about policy and advocacy work that is current and what we're working on right now. But really top of mind, I think, for people are the SNAP changes that are coming about and what's the implementation process. So that's kind of as far as high level what you're coming to hear about today is that implementation process for the changes that are being rolled out since the budget reconciliation.
I just sent it by email, so hopefully she'll pop on.
And I know we've gotten a few more people, so I'm dropping in the chat again the link to our agenda. And again, if you're just coming on, we're putting our names, organizations, maybe your email or contact in the chat. And if you're new to this coalition and just want to say hello, we want to welcome you. And if anybody is coming with any big questions, we can prime the meeting with ideas of questions that you're bringing here. Make sure that they get answered today. How about any, yeah.
Did Deb get in?
I haven't seen her yet.
Okay, let me,
how about any observations? What are people seeing as far as SNAP? Any questions that people are coming to you in your organization and asking? Oh, there she is.
oh, great.
Welcome,
no,
Deb.
That's my biggest challenge of the whole day.
Sorry about that. I thought I sent you the right link. I apologize.
No worries. Good morning, everyone.
Good morning. Thanks for being here today. So I think I'll let Laura guide from here.
Oh, yeah. I mean, Deb, we have cleared the agenda so that we could hear from you about what's happening as far as SNAP changes.
Yeah, appreciate that, you guys. I think you're probably aware because it took place a little while ago, some of the big changes within the federal bill were about internet and LIHEAP. Those changes are currently in place. Internet is no longer a deduction. And LIHEAP, the use of LIHEAP as a deduction is only for the primarily now what's our ESAP households, so the elderly and disabled households. So those things are currently already in place and have been for a bit. The two bigger ones, if you will, are the ABOD. I will back up just for a second about LIHEAP. We only had about 40 households who were potentially negatively impacted by that change because there's different ways to calculate deductions for the household. So LIHEAP, if somebody applied for LIHEAP, we just automatically, it was applied to their case as a deduction and it allowed the maximum allotment of SNAP without having to do anything else, just provide us that verification. But if a household pays for heat as an independent deduction, if you will, that also gets the person to the full benefit allotment. So there were only about 40 households, I think at my last view, that actually that were negatively impacted by the removal of LIHEAP. It was a very, 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 very small amount, albeit there were a few. So I just want to point that out. We were able to just make the switch behind the scenes and not request much because we already had verifications of people paying heat. So there was minimal impact on households for that one, despite the fact that it sounds big. The other thing that I'll say is we've got some of the bigger ones that are, coming up. We've been I'll be honest, a lot of it, the bill was signed, back on July 4th or 5th, and we've just been doing lots of waiting for FNS to provide guidance. They were constantly advising they were going to be providing guidance. A lot of things got impacted with the shutdown and people being furloughed. So as you can imagine, it's been a bit challenging for everyone. But for November 1st, we are rolling out the ABOD changes. Ray sent me a bulleted list of questions, so I will try to walk through those to the best of my ability and provide you guys some responses there. I will say for the non-citizen change, we are still in discussions and some development stages for that. There's a lot of just nuances. So we're working towards getting the implementation of that one. We have not yet. I can tell you for the non-citizen change, our most recent query was run yesterday. We're keeping an eye on the numbers. And that at this point could impact 204 cases. So albeit impactful for sure, very small number in comparison to the caseload for our 40 2,000-ish cases that we have, not minimizing the impact on those that it will have an impact on. So don't misread that, but it's just good to know it is a small number. In regard to ABOD, some questions that Ray put forward was about the understanding being that November cannot count as a first month, looking for me to confirm. So basically November is not a countable month for anyone. So I can confirm that. I think one of the things to realize about ABOD, no households had clocks reset. So, there's changes that are happening, but I just for conversation, there's no resetting of clocks. There's just different impacts on folks when some of the exemptions are no longer. So just a little clarification there that we don't have new clocks. But anybody coming in with a new application, anybody who's due for a READI, in November. We're not doing a countable month for November due to the shutdown and the disruption of benefit issuance. So just for clarification there. The other question Ray had about, is it happening at Reedy for folks? Yes. So any discussions and changes will happen at the person's next recertification. Again, clarification, if there's a new application, it's impactful, at application. So I think that's probably clear to you guys. Your question, Ray, is about could I confirm that March would be the first month that somebody could lose coverage? We need to be very, 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 very careful there. It's really a bit muddy. It's a case-by-case basis, depends on what folks already had as countable months. Again, the clocks did not get reset. So it's just, I don't want to say, yes, that's the first time anybody could be impacted, because that's not a true statement. There's a lot of nuances based on what they already had in their case. They might not have been impacted by the federal changes at all. Everything carries on. So that one's a bit tricky. If it needs a more detailed discussion, I'm probably not prepared to do that today with all kinds of examples and nuances, but if that would be helpful, I could get with my team and we could maybe do a little bit more in depth with some examples, but I just want to be careful that we don't want to say that as a definitive answer, basically. The other question was about people need to receive written notice, oral explanation about the rules. It's called screening. Yes, we are engaging in appropriate screening. We have a consolidated work notice, which is something that FNS strongly advises states to use even prior to the federal changes. It was something that we've had in the works for a while. It required some review with FNS, but a lot of it required systems changes, so things get backlogged. But we are hoping to release, it's called a consolidated work notice. If I'm lucky, it'll be for December 1st. It's still in a few review stages, to be honest with you, but as soon as we have that ready, I will let you know and I can get you guys a copy. The beauty of the consolidated work notice is it is tailored to an individual, and it really basically explains to them you are subject to SNAP work requirements. And if it's somebody under the age, 59 and under, not the new group of 60 to 64, it tells them they must comply with the general work requirements and potentially ABOD. And it just sends them through a list of, again, it really will say, Mary Smith, you fall in this category. Go to page 2 to read the specifics to see if any exemptions apply to you, et cetera, et cetera. It's a little complicated. And if there's a household that's got people that fall in different categories, it is, again, specific to each individual. So it might say, Mary Smith, you have to comply with these, go to page 2. John Smith, you are required to comply with this, go to page 3. Hard to explain without a visual, so I apologize because it's still in draft, but very tailored to each individual member in the household who is subject to work requirements. So it's a really great notice. I will say it probably would be really beneficial for me to review it with you guys to see it, because it appears to have a lot of pages, but if you follow the design of where to go to get your specific information, it is very simplistic. So I will offer that when that's ready to go, we've got the final version. We're going to start kind of pushing that out to households. If you would, whoever, Laura, I'll defer to you. If you guys want to pull a group together with me to review the notice in person, be way more helpful than me trying to do it with you without a visual. So that is,
I think that would be great.
okay. It's going to be a really, really great tool. So I just want to advise that that's one thing. The other thing is, yes, we do know that we need to speak to individuals in that notice. They will be advised if they think they need an exemption to call. We've got a plan in place. We're gearing up some training on how that will take place. But yes, we are obviously aware of the regulation to do proper screening and to communicate appropriately with the individual. And all of that's part of the training that's going out to staff as well, with expectations on what they need to do. So they've gotten some highlights of it, but we're firming that training up as we speak, actually. I think I'm trying to look at Ray's questions and again about screening at the next READY. Yes. If they report a change during their certification, we'll manage the change, but the impact of the ABOD change itself would not happen until the READY. So if they reported, the question was if they reported a change in rent, for example, or expenses, the change would be processed as business as usual. The conversation about the work requirements would happen at the READY. I don't see Ray because there's a lot of people, so my assumption is maybe he's here. But if I'm not answering your questions, Ray, jump in. Will notices specifically inform people when their first countable month is? That's not something that we have currently. And again, clocks didn't restart. So those are conversations that happen at application and or recertification, because obviously that's very different for every individual depending on their circumstances. We did send out a heads up letter to all households, just that there was a federal change in this regard that also gave them an overview. I'm kind of pleased to say we've only received, that I'm aware of, because that went out a few weeks ago, one call on the letter. And actually the individual that called was an auth rep for somebody who gets SSDI, so they're not impacted by the change anyway. But I'm only aware of one call that was generated by that heads up letter. So that in our eyes is always a good thing. And if people understand that they'll be working with their FSS worker at recertification, hopefully that's helpful as well. Questions?
I'm sure there are lots of people on the call who work with folks who will bring that letter to them. And so it'd be lovely, or they will bring questions about that letter. And so I was wondering if you would share the letter so that we could share
The heads up
yeah,
letter.
yeah, that would be great.
Yeah, I was thinking I sent it. You might have noticed a little pause as I was speaking, because I'm like, I thought I sent it. Did I send it? But no, I can get it to you and you can disseminate. And same with the once we get the consolidated work notice completed as well. But yes, I can get you a copy.
And there's a question in the chat about the differences between SNAP work requirements and Medicaid work requirements.
Yes, so lots of meetings happening in that space as well. And we are, the Medicaid ones don't happen this early. So we've got several different versions of teams working on it, of which I participate, I think, in just about all of them. But they're pretty close. They're pretty close. Actually, what I offered up at an upper management level meeting yesterday, I was working with, for those of you that know, Henry Lipman. And what I offered to do for him from our policy lens is to do a comparison sheet for some of our upcoming meetings, where we can do a total crosswalk of where is there a cross, where it's pretty similar. We're seeing a lot of similarities in the general work requirements for SNAP and what's coming down the pike for Medicaid. Those of you that were around several years ago when we kind of went through this already, we found a lot of things that if you were working in one, under one umbrella, if you will, it most likely pertained for the other one. So we're gearing up for that to make it as simple as possible, not only on the client, but the workers, the community as well, to understand. And I should hopefully have that document. I'm hoping, my goal is, from the individual providing it to me like the end of the week, but they're close. What I'll say is there's close, and what we're doing is a deep dive on, but if there are any nuances that make the Medicaid one a little bit different. So we are also working with the systems team to ensure where we can that the information is all, free flowing back and forth between both programs. This is one of the strong benefits to New Hampshire having integrated eligibility. So sometimes we find it a little bit of a pain and other times we find it a perk. this will be one of them, because if we've already determined somebody for SNAP is meeting general work requirements, and then a Medicaid reading takes place in their SNAP Medicaid, the information will already be in there for the worker to be able to just assess it and hopefully use it for Medicaid as well. So, and the Medicaid readies, I don't want to speak like I'm the expert on this right now, but you know, and what the date is, but their redeterminations are going to be switching from 12-month to 6-month. So that change, you know, we'll do a lot of working towards trying to align those readies where we can. So a lot in that space that's still in discussion, development, training prep. There's all kinds of things that are still happening because they are not at the same trajectory that we are for SNAP, but we are very much on top of it.
Great. Ray has a question.
Thanks, Laura, and thanks, Deb. This was super helpful. I just
Sure.
wanted to follow up on, I think you answered all the questions I had. I just wanted to follow up and if this might be something that would be easier to take offline if it's because of what you said, but I think I might have either misunderstood or got some bad information yesterday about when the clocks start and the first month of potential termination. So I don't know if you're able to say, but I was wondering, so if someone say has a redetermination due in December, if they already had 2 countable months and they don't meet an exemption and they're not meeting the rules, does that mean they could lose their SNAP in January? Or say they had the 3 countable months ready, sorry, they could lose benefits potentially in January.
Correct.
Okay.
Yeah.
So
Yeah.
thank you.
When I
That's
read it, I
helpful.
went, oh no, where did that come from?
Yeah, I think I'm going to follow up with them because unfortunately it was on a call, a national call where someone mentioned that. I don't know, Laura, if you were on that same call, and so a lot of people heard that. So I was going to
Yeah.
email them after this meeting to let them know what we learned.
Wing back with me, Ray, after if we need to like revisit something. See, this is where it's very tricky and like it's really important, right, to not do blanket statements in these scenarios because there aren't any, right? Every individual person, not even case, the person themselves is very individualized in this process, right? You could have somebody in a household who's 58 and a spouse is 64. They've got distinctly different work requirements that they have to follow, and they're all in one case, right? So we don't even talk about it as case impact. It really is person. Everything's context. So context is big, right? Now, where that would be true, Ray, is if they're a brand new SNAP applicant, never like we've got nothing on them and they're starting fresh, that would pertain, right? That question. So
And does that mean, sorry to interrupt, but just to follow up, does that mean the people who are newly subject to the rules that with the age limit being increased, that would be true for them as well?
there's some
potentially?
nuances there as well, and it's looking backwards and seeing if anything. I'd like to know the context. If you can find something out, I would love to take it offline and just for us to make sure we're very much synced up and I'm answering it in the right context as well, because this gets, again, tricky.
Yeah, I wonder, as you were just talking there, I wonder if what they were referring to is people who were not previously subject to the rule, who are now subject due to the changes, in the age limit and
Yeah,
kids with children who were previously not subject. So I think
exactly.
maybe they weren't clear in that they were referring specifically to those folks and not
Yeah.
the prior, people who were already known to you and who were previously subject to the rules before they were changed.
We will never say we're experts by any means, but we try to do the best we can. And we still every day come up with oh, hold on a second, wait a minute, let me think. Let me pull the regulation, let me look back, let me make sure I totally understand your scenario because it's that unique. One very unique thing to be aware of that we kind of grappled with for a while, I'll be honest, we kept pushing back on FNS to really put the words in writing for us. Because on my own policy team, I had 2 people who were totally interpreting some of this completely different, and they're both very strong I aligned with one specifically. We'll just leave all the details out there, but I had somebody who was not in alignment with us with how it was being interpreted, right? So a lot of this is interpretation. So we just kept going. I'm always, I have to be fair to the team. As soon as I've got one holdout, I have to take it to all the way to the end, right? So where this conversation was taking place is about for the people that are now 60 to 64, right? Because typically what was happening is if you meet a general work requirement, which was up to age 59, you were automatically all set, I'll call it, for ABOD, right? So with all the federal changes that came out, there was never any discussion or indication that the general work requirement age was going to increase to the 64, right? There was nothing really stated. They stated about this new group for ABOD, 60 to 64. So I'll just share for the story to just see how like crazy this work can get sometimes. One of my policy folks felt very strongly that, well, obviously the general work requirements is going to change and go to 64. And why would they not change the general work requirements, right? Because, in some weird days, that's your logical brain, of course, because that's the way it works. You meet general and you don't have to worry about ABOD. They're only going to change the age for one group. So we were stuck. Well, they only changed the age for one group. So general, very confusing. So general work requirements only goes to age 59. If the individual is 60 to 64, we don't even look at general because it has nothing to do with them. They're aged out of general work requirements. They have their own work requirements, just ABOD. So I'm putting that out there just in case people are reflecting on, as long as you met general, you are all set for ABOD. Only if you're 59 or younger, does that still pertain? So it's just one of those, we finally got written clarification. It took some back and forth, even with our federal team to get there, and they were working with national on that clarification as well, because again, logically that makes no sense, but it is what happened. It is what happened.
Could I also ask a question? Just
Sure.
something you said. So thanks so much, first of all, for all this is really helpful because I'm understanding some things for the first time myself. And one of the things that you said struck me, and I'm kind of still processing. So someone, just going back to your what you said about households and individuals, and how an individual might have a essentially different for example, months on the clock and things like that within the household. So what does that mean from your end in terms of, does that mean the household changes in the number essentially? Because the rest of the household could continue to get a benefit, but the calculation is the benefit is reduced based on household size, or how does that?
Yep, exactly that, Dawn. It's like
Okay.
anything when somebody moves in and out of a household for whatever reason, right? So it's just
Okay.
like basically if somebody was subject to whatever, use their 3 countable months and they no longer are eligible for SNAP, but another member in the household, or they have children or whatever the case may be, still has eligibility without any issues at that time, then yes. If it was a household of 4, one person met their 3 countable months, has no exemptions, now the household's going to be a household of 3.
Okay.
Correct. Yeah.
Thank you. Thank
Yep.
you. That's helpful.
We
I
had,
hadn't thought about that at that
yeah,
level.
I know, right? We did a great deal of work with our systems team to improve upon, if you will, the screen that our workers in our New Heights system, the eligibility system, we've enhanced the actual screen where all of this is calculated, gathered right down to the individual. They can see how everybody, I mean, we made it clear as day for them, at least in our eyes. We haven't heard any complaints, but we really enhanced that tool for the worker to go to what we call one particular screen where they can see the household members, they can see exactly who has what, which work requirement they must follow, et cetera, which then also helps generate that consolidated work notice. So, I mean, it serves many purposes, but yes to your question. I think for a second, there was a couple things, Ray, that you had in your question list on the non-citizens, which I say, like I've explained, is still under development, but they will also be screened, if you will, at their next recertification, you know, once we're all rolled out. I want to confirm that for you. And basically there was a question about legal permanent resident and having to do the new yes, the 5 years starts when they reach that status. So the way that the regulation's written.
I think, Deb, not everyone on the call saw the question, so if you don't
Oh.
mind, I'll just say real quick.
Sure.
to people. I had a similar question. There were changes to the rules around which non-citizens, which immigrants qualify for SNAP, and so I had a similar question for that group of people as we did with the ABODs. When would DHHS first kind of screen them to determine whether they are still eligible under the changes or whether they're going to lose benefits if they're a current recipient? And so it sounds like, Deb, it was the same answer, that it's both new applications, of course, that come in would be screened at that
Correct.
time, but then current recipients, it would be done at their next redetermination.
Correct.
Okay, thank you. And then, and so I guess just to follow up on that for a moment, do you know yet if that person reported a change, say to income or an expense or something, would you also screen their immigration status at that time, or would it be similar to ABODs?
That one's different. So the federal regs came out different for that, right? So basically that needs to be done whenever we're looking or reassessing, redetermining the case updates. So it does appear we've got that still as a slight outlier to make sure we're 100% confident on that, but it does appear it's different guidance than the ABOD.
Yeah, and just to give you a heads up, we're still also tracking this, but when we read the guidance, it said we certainly were required at redetermination, but we thought it said states were strongly encouraged, but not necessarily required to do it. And I think there's actually been some talk about whether that is consistent with the regs. So I think there's actually some national entities who, it's very early, I would say, but are looking at possible litigation if that's the way it goes. So we were hoping DHHS would choose not to do that since it's not a requirement, and just save it for redetermination, even though I acknowledge the Fed said that you're strongly encouraged to do it.
Yeah, and I think that's interpretation. We're being careful, and again, it's probably on it's on a plate of things like why we haven't rolled out, right? So I wrote it down just to refresh my memory to go back to where the team's at working with it. But if it is truly strongly encouraged versus required, if you will, we would absolutely be, we're always leaning on the side of the client and, minimizing impact to the best of our ability, for as long as we can. But I do believe that was flagged. I just hadn't gone back to look at that before today, but I can confirm that we will do everything in our power to do it at Reedy if we have the liberty, is probably the best way for me to say it.
Thank you. We appreciate
And the
that.
furlough is over, and we have started to receive some communications from some of our FNS partners in Boston about a litany of things that were on hold. So they're back around. I will say, though, for those of you that might be aware, Matt Henschel, in his capacity as, I'm not sure if he's what his exact title was, but he was somebody that was available to us even during furlough in Boston, because he was actually working, and we did have several conversations with him, just sharing that we weren't totally cut off from FNS at any point. But now that the full team is back, all those free-flowing conversations, we'll have more avenues to get questions asked. But Matt was phenomenal, and he had a direct link to National with our questions, and they were being managed. So I just want to share that as well.
That's great. I thought you were going to say he left, and that would have been a huge loss.
Oh, I might.
It's what I thought too. I was like, oh no.
That might cause tears over here. We have a very, very, very strong working relationship with him and that team. So we are never, I will honestly say this, in the dark where we're not getting responses, or he literally jumped on calls with myself and my team when we had some nuances and he got direction from National on a few things versus trying to go back and forth in emails. So he's just phenomenal. So I just want to, for everybody on this call, our relationship with the federal partner is very strong. I don't think all states necessarily always feel that way, but we are blessed in that way. So we kept as current as we could, and we still have outlier questions just as we're working through our own internal process. So I will look at that a little deeper, Ray, and I can get back to you on that one as well.
Thank you.
Sure.
I think Don has a question. No, Don had a hand up. Okay.
I will
Um,
say a lot of
Maybe he's clapping for
information.
Matt Henschel.
Oh,
Yeah.
yes. Just, I don't know. We work very, very well together. There's a
That's
huge
great.
collaboration there. A lot of information, you guys, a lot to absorb. And I'm trying to be very aware of the time for all the rest of your agenda that you had. So probably speaking a bit quickly to get it all out there. But feel free either through Laura, Ray, Dawn to, shoot us questions, myself directly if you have them. Or, however it's best for you folks to manage that. I always say when there's a big group, even in-house for our own teams, it's usually best most times to have one centralized person that's sending the questions so that then they get disseminated out to all, even though all might not be asking, if that makes sense. Because a lot of times what somebody's asking, somebody else might be thinking or didn't think about, right? So maybe best, Laura, to go through you, but I will defer to you on how you guys want to best manage that.
No, absolutely, absolutely. Send things to me and I will share with everybody.
Okay. And if you have
and-
questions, if they send them to you, you can send them to me and then back out is probably best.
Absolutely. And we would love to follow up and be able to ask more questions because I think, we just want to make this as easy as possible for people who are eligible to be able to do the things they need to do to stay on the program.
Yeah, concur with all of that.
There's a question about what's a good email for questions.
So Laura, if you want to
send
be
things to
the
me?
centralized
Yeah,
point,
so
I'll
why
let-
don't you send things to me and I will put my email in the chat.
Perfect. Again, guys, it's not that I'm not available, but I think I just really want to make sure that every single person on this call, if there's a question from anybody, gets the same response back. It just helps everybody, I think. But I am available independently if need be. Okay, so Ray, you're going to circle back with me about that little nuance on how the question was I'd like to just have that conversation. That would be super great. I will send through Laura the heads up notice that went out to all the SNAP households about the changes. And when our consolidated work notice is prepared for release, very, very close. I'll be sure that you guys have a sample of that as well. More than willing to walk through that with anyone that might be interested. Again, I'll let Laura drive that ship. And as we walk through our non-citizen final phase here, the final change, as we get closer and we have things synced up about that, we can keep you guys informed also. It was interesting. We ran a query about a few months ago, probably back in July, to be honest with you, when the bill was signed. And at that time, we recall having about 282 households that appeared that were going to be impacted. And for whatever reason, people just don't recertify or whatever, that number's come way down. So, well, down to 205, whatever it was, which in that small space was a considerable. So some of that just took place on its own. Usually, why is that happening? Folks just in that category might not be doing their redeterminations would be the reason. We didn't make any changes to them. By osmosis, it's just happening. So the number had changed.
Deb, did you share the number of people who will be affected by the ABOD, the new ABOD changes?
Oh,
Do you know that off the top of your
no,
head?
and I think we all we do is lots of queries because we're constantly looking to report up to the commissioner like what those numbers look like, so it gets to the governor. I have them somewhere. I definitely have them somewhere, Laura. I did not bring them today, but I can pull that for you. But again,
That'd be
it's nice
great.
to know that our communications are go all the way up through upper management to commissioner level, governor as needed. So again, there's a tight working relationship in the department and the state that way as well. Yeah.
Great.
Okay. I thank you guys for your time, and hopefully it wasn't too much information where you're in overload.
Thank you so much. I really,
Hopefully
really
there was more
appreciate you
clarity
coming.
than confusion, but let it all digest and shoot Laura your questions, and I will be as responsive as I can to get you the answers.
Thank you.
All right. Thanks, guys.
Bye-bye. Okay. Questions?
I think, Laura, I'll just jump in and say, given the time, I mean, certainly we can have a general discussion, but I think we could commit to doing a follow-up to this with some written materials so that people can see it all laid out. We were going to do that today. I was going to do that not knowing if Deb was going to be here, but it would have been a little challenging because, as you heard from Deb, there was a lot of stuff we didn't know what DHHS was doing and when. Obviously there was of course, some clarification too. So I'm kind of glad she was able to come today and we didn't do that and risk confusion or saying something that wasn't fully correct. So, but now that we have this info, we can certainly put it down in writing and work on a PowerPoint. But I don't want to short, if there's follow-up questions while things are fresh in people's minds, we can certainly talk about those right now.
I just thought because she was using a lot of acronyms and responding to your questions, Ray, that we could just sort of like do a very basic review of what she said. Because I was trying to put things in the chat to explain what we were talking about, but I think it was a bit confusing.
Yeah. So yes, and people should feel free to jump in, interrupt, or raise hands. So there, within the SNAP program, there are work requirements, and I think Laura laid this out nicely in the chat. But maybe for folks who might not, who didn't see it, there are two types of work requirements that Deb mentioned. There's the general work requirements, and then there's the ABOD requirements, which I don't even know if we said this all out. It's the able-bodied adults without dependents rules. That, because of the changes you'll hear about in a moment, that rule is no longer completely accurate, I think, but often just referred to as ABODs for short. So the general work requirements didn't change. So I'm just going to put those aside for a moment, but that's something we could talk about in a presentation. For the ABOD rules, they're more strict, as Laura mentioned in the chat, and these are the rules that are more likely to lead to a loss of benefits or potentially a denial of benefits. And so if you are just to start out, if you are subject to these rules and you don't meet an exception, then you can only receive SNAP for 3 months within a 36-month period unless you meet the rules or meet an exception. So if you're subject to the rules, you're not currently meeting them, and you're not exempt, then you can only get SNAP for 3 months. After that, you either have to show you're meeting the rules or you have to show you meet an exemption in order to continue. So that's where we were kind of getting into the weeds a little bit about what's the first month of termination. And that was one of my some of my confusion on that based on something I heard yesterday about what the first month of termination is. Previously, and I want to pull this up so I don't say anything. prior to the change that was passed in July, individuals were generally subject to these rules if they were between the ages of 18 and 54. One of the key changes that we were talking about is the age limit was increased. So now it's up to 64. And so if you are anywhere between 18 or at 18 or at 64, you are potentially going to be subject to these rules. And so that's the new population that we were talking about in one sense is the people between 55 and 64 who have were not previously subject to the rules, and now will have to understand what they are and meet them in order to maintain their SNAP beyond that potential 3-month time limit that's imposed. Laura, did you want to jump in? You came off mute.
No, I was just going to add that the other new populations are people who were previously exempt from those ABOD rules.
Yes. Yeah. So there were
ahead.
changes to the exemptions, and people might remember the exemptions under the prior administration were expanded. It came kind of out of COVID and then were made permanent. And so those were removed. So those were 3 exemptions for homeless individuals, veterans, and individuals who were age 24 or younger and who had been in foster care on their 18th birthday. They, in the last couple of years, were determined exempt. They are now once again subject to the time limit. So that's an area where there could be confusion, I think, because this was just a recent change that's being undone. The other one that's significant is it used to be, because the rules were that able-bodied adults without dependents, it used to be that if you had a dependent who was a child under the age of 18, you were not subject to these rules. Now that age was changed, so you're only exempt if you have a child under the age of 14. There are people who never had to, again, similar to the age range, who never had to deal with these rules because they had children. And now, if their children are older, they're going to be newly subject to the rules as well. And Laura just put a helpful form in the chat that I think is appearing on everyone's screen right now. Laura, I didn't know if you intended to share your screen, but your screen's up just in case. So you can look to that one pager that DHHS has created, and thankfully it does include these new changes that we're talking about. And so you can look there as a reference and as a summary, because there is a lot. And so I'll pause there for questions. I think, in a future presentation, we could go in, how do you meet these rules and how do you verify an exemption? But we can take questions on that if people have them. That information is on this form if you're looking at it.
That's actually Heidi's screen, not mine.
Oh, great. And I'm glad. I just want to make sure whoever was sharing knew they were sharing, so they didn't toggle over to some emails or something.
I was like, what? How did I share my screen? I don't know.
Sorry about that. I was trying to reference my notes, and so I didn't see who was sharing. I just saw it pop up. So there's a good question in the chat. How does it work for children on a parent's account that turn 18? Do they need their own case? So this is a good question we could dive into. So the answer is no, they would not be on their own case. Children, if they're living in the home with their parents, have to be on, no matter what, have to be on the parent's case until they're 22. They can't apply for their own case if they're in the same household. So for those people, for those young adults, it gets a little complicated because if they're in school, they might be subject to different rules. There are different rules if the child is 18 and still in high school versus if they're 18 and starting college. And so they may be subject to the college student eligibility rules, which we've talked about, I think, in past meetings. If they are not in college and not in high school, then they would be subject to the ABOD rules that we're talking about. And so that gets into the question that Dawn had for Deb, where the ABOD rules are really about the individual, not the household. So you may have someone in the household who is subject to the ABOD rules and not eligible to receive SNAP, but other household members are eligible. And I think we'll start to see that more now, especially because the age of dependence was decreased. So you may have a situation where, you know, you have say it's mom with 2 kids. Those kids are 16 and 17 and they're in high school. Mom is now subject to the ABOD rules because the kids are over the age of 14. And so if mom is not meeting the rules or does not meet an exemption from the rules, then she is not going to be eligible to receive SNAP, but her children might still be eligible to receive some SNAP. So in that case, the household may not lose benefits altogether, but they're going to potentially experience a decrease in benefits because mom would not be a qualified person, would not be eligible. So that can happen. The reason I mention that is that can happen with children who are between 18 and 22, because if they are not meeting the college student eligibility rules and they're not in high school and they're not meeting the ABOD rules, then it may be that that child or children are not eligible, but maybe younger siblings who are on the case and parent or parents on the case will still get benefits. So it does complicate things more. And we can go into this in the presentation if people want this level of detail, but to Dawn's question, there is sort of a calculation that they do when they remove, say, one person from the household, but still do calculate benefits for the rest of the household. It's not as easy as just sort of removing them and sort of decreasing by a specific amount. It still all depends on, you know, the income still counts, for example, or there's sort of a different math that's done in those situations.
There's another question in the chat. I don't know if someone's about,
Oh.
I don't know if you can see it, so I'll just say, how do those
Yeah.
that are volunteering instead of getting wages verify the participation?
Yeah, so, and others, please jump in. I know this is something that Heidi and the food bank have been exploring, but I don't believe there's been a change. This could be a follow-up question for Deb. I don't believe there's been a change to this policy. So the current DHHS policy about verifying volunteer hours is a signed and dated statement from the agency or individual entity that the SNAP recipient is performing the volunteer work for, and that signed statement has to include the monthly hours because that's the key. So it would, I don't know, Heidi, I'm not sure if you're aware if there's a specific form DHHS has created for this, but doesn't necessarily, even when DHHS has forms, it doesn't necessarily have to be on that form. Any written statement that's signed and dated with those hours should work.
Yeah, we haven't been able to discover that yet, so.
Yeah, that will definitely be a follow-up question from us. Yeah. I mean, this is a real good opportunity for us to work together with the department to make things easier.
Yeah, along that lines, another one to note, just if you have a list, Laura, and I always email you this as well, but one thing that came up while she was talking that Ray and I were chatting about on the side was the Medicaid work requirement, the change in redeterminations from 12 months to 6 months. And she talked about aligning that, but that doesn't go into effect until January of 2027. So let's not get ahead of ourselves.
Yeah.
Yeah, that's a good point. That's one thing to flag, and I'll make sure to try to remember this for a future presentation. The changes to Medicaid were delayed in most instances, and so So for example, even though the rules about which non-citizens and immigrants are eligible for benefits changed in the same way, they are not going to be implemented for Medicaid until next year, I think in October. I didn't want to, Deb was throwing out a lot of information, so I didn't really want to get into that. But so we will potentially see, I think likely to see situations where, say, for example, a refugee loses their SNAP, but is still eligible for Medicaid because that change has not yet gone into effect. And if anyone's been following the shutdown and, you know, the political stuff, discourse on the federal level, like there's talk about whether there's any possibility of rolling back some of those changes around Medicaid. And so I think, I don't know, you know, I can't tell you which ones are more likely than others, but they were delayed for political reasons. And so that's possible that those even change between now and when they go into effect. I think, unfortunately, it's probably unlikely the immigrant eligibility rules will change, but I think some of the other stuff could potentially change before the date, you know, of when they have to become effective and go into place.
So we have some tools that we put in the chat and in the agenda that give information about what has changed. But we will also be creating more, and you should feel free to reach out with questions, you know, for us, but also for Deb Sorley, and we'll pass those along. Also, if you'd like to be a part of a conversation with the department about these, let us know.
And there's a lot of people on, which is great. So just as a reminder, hopefully everyone knows, if anyone does receive a termination notice or a denial notice, you can always refer them to 603 Legal Aid. I put that in the chat, and that's our sister agency that kind of screens cases. But any sort of change in benefit, termination, denial, even a denial, if someone believes they should meet an ABOT exemption and the department says no, they don't, you know, that is also something that could potentially be appealed. And so you can please refer them to 603, and those cases will come to us for potential representation. And so,
I mean, I guess that would also, the way that I'm wondering too, right, and maybe there's a distinction here you want to make, but if their benefit amount is reduced, that might be the best way that they know. So it's not just terminated, but it's like if their benefit amount is reduced, it's
yeah, I mean,
also
and I'll
maybe
just say,
out, or
in
is that
general, this,
overly?
yeah, that's 100% correct. And the SNAP rules are pretty broad, and any change or disagreement, someone has the right to appeal. So yes, so it doesn't have to be a full termination or full denial. If the benefits change and are reduced and they disagree, or they're not sure why and they want someone to look at it, those would all be reasons to contact us. And I guess, I know we're running short on time. One other key thing, just because it's a big one before we meet, if a person is considered under the rules to be unfit to work, they are not subject to the ABOT rules. And this does not mean that they are eligible for a disability-based benefit. So certainly if they are eligible for Social Security disability or SSI, or they're getting aid to the permanently and totally disabled, Medicaid or cash assistance, they would not be subject to the ABOT rules. But if they're not getting those, they can still be exempt. They would need a statement from their medical provider about their unfitness to work if it's not obvious. That's the language under the rules. So that's a big one just to know. It's not just tied to a disability benefit. It's a different standard. But you do need verification. I think in most instances, people will need verification, especially since so much is done over the phone and not in person these days.
Ray, would that include like if somebody were in the process of applying for disability?
Yeah, potentially. Yeah, even though they don't have that official decision, and it also, and I would say even if they were denied SSI, you know, the disability definition, for example, to receive SSI, SSDI, or aid to the permanently and totally disabled, it's a pretty high bar. And so I would say, yes, while their application's pending, if they believe they have a physical or mental impairments that make it them unfit to work, they can certainly seek that exemption. And again, they would need some documentation from medical records or a letter from their provider. But even if they're denied, that shouldn't preclude them from seeking this exemption under, they may not have a good case to appeal and get the actual disability benefit, but they may still be able to meet the ABOT exemption, even if they fall short of that federal disability standard.
Well, and
Great,
one of the
thank you.
things that I've seen other states do is provide some guidance for medical professionals about how they can help folks who can't work stay on the program. So I think maybe that could be a conversation we could have in the future.
And now we're really going over it, but I think one of the keys there, sometimes that we have found that medical providers are hesitant to, say something to the effect of like, this person can't work. And it's not so much, that's sort of the legal conclusion. What we usually ask them is just to say, can you write about, what their diagnoses are, what their limitations are? They don't have to necessarily make the jump to say, because also the standard is not that they can't do any work. The standard is just that they're unfit to work, which I know is still kind of vague, but really what the documentation needs to be is documenting what the health issue or impairment is, and how that might impact the person's ability. We don't need the doctor to make that, that's where we've run into doctors being hesitant, is like they don't want to say the person's disabled or can't work under the federal law, but we don't need them to. That's not their role.
So I think we should wrap up. We're over time, but I think New Hampshire Hunger Solutions will do its best to get out information as we have it. But please, if there are tools you need, if there are questions that would help you help your clients, please let us know, and we will ask the department to clarify, and we will, if there aren't tools to guide you, we'll work on creating them. Thanks, everybody.